I'm Dr. Courtney Washington. I'm a board-certified family medicine physician. I work outpatient medicine in the clinic. Also, I work as a hospitalist, and sometimes I work in the critical access center around the greater New Orleans area. I've also worked in more suburban areas in the ER critical access centers in Texas.
Hi, my name is Shalita Carr. I'm a nurse practitioner, board certified, also working in hospital medicine, family, and clinic medicine.
Okay, so today we wanted to talk about Dr. Carl Hart. He recently had an interview with the Breakfast Club, and he was discussing his book, basically describing how to take recreational drugs safely. So we found it very interesting as we deal with a lot of patients and families who are addicted to various substances. I also am Suboxone certified, so we wanted to discuss different things on what we've seen clinically, and also note that Dr. Hart, very well educated, but he is a doctor of philosophy, so he's not actually a doctor of medicine, as you will. So what did you think of the interview?
Well, I thought the interview definitely gave a different splice to drugs, but a lot of the information from what I know from both a chemistry standpoint and from what I deal with every day, just with drug abuse, with families, even professional people in my own walk of life that have become addicted to drugs that are responsible people. I just felt like he had a lot of false information that he was displaying to the public.
I definitely agree. Drugs, especially heroin or your opioids, decriminalizing them, I actually am an advocate for decriminalizing them, but I definitely don't advocate people to try it, which I'm not saying that he's advocating for people to try it and see how it is, but I definitely want to send the message of not to start it. I always have had a high respect for drugs, and even over-the-counter drugs, as I don't know if I'll get addicted to it, but it definitely has destroyed families. Heroin, it is a derivative of morphine. Morphine is derived from a plant, but also it's chemically processed to add two acetyl groups to it so that it binds a little bit tighter to certain of your opioid receptors, especially those that cause pleasure and euphoria.
Yeah.
And as a doctor of osteopathic medicine, I believe in the body's ability to heal itself. So there are certain other things that you can do, exercising really vigorously or enjoying time with your family or vacationing, that can give you those sorts of euphoric feelings without having an addiction to it.
If I may say something about that as well, is I think I don't want people to get misconstrued about morphine and heroin and think they are alike. They are like, any time that you add any type of chemical component or take something away, it changes the structure of the atom, and it thereby changes the drug. So morphine was something that was created for pain relief. If you use morphine in large amounts, same thing as oxycodone, without any benefit of Tylenol or with the benefit of Tylenol, you will addicted to the drug. But heroin itself is a very chemically different drug from although morphine. It is not to chemically restructure that drug. It's no longer. So I want to make that really clear. I did take a few notes as I was listening to Dr. Hart's video, just because, I mean, guys, I see this stuff all day long. I have had personal friends of mine that were physicians and were very responsible people that did 12 plus years in medical programs. So that alone is very disciplined to end up on drugs. So you can't say who will end up on drugs and who will not, who will chemically have that hamster wheel that goes to turning in their brain and can't pop off of it. So I'm just saying that I think that it's a bad idea to put those two drugs and make people who are not aware with the chemistry components of it, and make them believe that these things are chemically related. They may have some structural similarities, but they are not the same drugs. And I also wanted to speak to the fact that Dr. Hart also mentioned that these drugs can't kill you withdrawing off them, and that is absolutely incorrect. So these drugs create more heroin, alcohol abuse can do the same, but I don't want to relate the two together because they are very different. So when a patient shows up to the hospital and say they are withdrawing off of heroin, we are bound by law. ethically and morally to admit these patients to the hospital, because it is not something that they can mentally just get over. So they have to physically be treated in the hospital for some of those physical symptoms that can cause tachycardia or increased heart rate, that can cause ischemia and decreased blood flow to your organs and things like that. So it gets more profound than what Dr. Hart is making it seem. I think he has a great message when he says, for people who are using, I want to make this safe for you. But you have to realize we are not in Europe, we are not in Switzerland, so we are not in places we have legalized centers for these people to go in and test their drugs. Most patients that I see, that I speak with, even the ones who have been able to become clean, when they're chemically altered with their brain, they are not at an advantage to say, let me go test this drug. So they're not making really wise decisions. More so if you just look at the fact that we do have things like needle exchange programs. So we're trying to make it safer for you to stop getting bloodstream infections and getting vegetations on your heart and things like that. So these patients are not even able to, I'm not going to say patients, individuals as a whole who are chemically dependent on a drug, especially heroin, crack cocaine, things like that, they're not even able to mentally make a decision to go get a clean needle. So this goes beyond responsible people. I've had a lot of responsible people that become addicted to drugs that has destroyed families, including mine, and we'll talk about that later.
Absolutely. And to your point, injecting any substances, there are no medications to where any physician or practitioner would advise a patient to self-administer and find their own vein. Injecting any substance, and if you don't know what you're doing, can introduce bacteria that's normally on your skin into your bloodstream. These things can seed on the leaflets of your heart and cause serious complications to where you'll have a 20-year-old that needs a valve replacement, which is a very, very intense type of surgery. So, and I also noted the point that Dr. Hart said that heroin can be snorted. Well, heroin only has a short half-life. So, but for the majority of people that do use heroin, they want the more potent effect because they want to feel that same euphoria, so they will be more likely to inject this substance. Another point that he made was that he advised people to go into a comfortable place and use their drugs. Well, I also admit patients to the hospice unit, and it's very, very sad because some of these patients or people do that, and when they do overdose, because those drugs, especially heroin or other opioids for that matter, bind to the parts of your brain that tells your body to take a deep breath. So they end up with an anoxic brain injury, which is a brain injury due to lack of oxygen to the brain. And once they're found because they haven't answered their phone or what have you, they're technically brain dead. So that is definitely not safe. So what we always now, we're trying to do more things with administering Narcan, even with prescribed opioids, to where if you are going to take these medications, say if I have a patient that had a knee replacement, which is very painful, if I'm going to prescribe an opioid, sometimes I do prescribe Narcan so that a family member checks on that person and they can administer this drug to reverse the effects of that opioid, because we are in a huge opioid crisis right now, and putting that type of message out there that there is some safe way to use a recreational drug, it is just not realistic.
Not. I also wanted to speak to the fact I did take a few notes, so I'll be looking back and forth at my notepad just to clarify some things. Dr. Hart mentioned that 75% of people that are on heroin are not addicted. So I do know that he does a lot of research. I'd like to see that research, because I can tell you now, I'm going to do my own research. I have multiple patients in the hospital and long-term care units. These are younger people that are recovering from bacteria infections in their bloodstream, vegetations on their heart, can't get valve replacements because mentally they haven't dealt with the things that have driven them to the drugs. So people don't typically go to drugs because I just want a euphoric experience. People go to the drugs because they have underlying things that are driving them. They're depressed. They have social stressors at home that they are not adequately dealing with, and they want an escape route, and it's a temporary escape route. So 75% of these people are not just not addicted. So a lot of these people are missing work. I've had professional, as I said, physicians, nurses, all who have been unable to combat the addiction of the drug. Another thing I wanted to bring up really quickly, and Dr. Washington, while I pull it up on my phone, you might have something you want to speak about.
So I did a little bit of research on the topic myself, as there are constantly journal articles and things being researched as medicine is ever changing. The brain is very, very smart. It's the most powerful organ in your body. So I wanted to talk a little bit about how drugs, not just heroin, but drugs in general, and we'll focus on heroin for this example, work. So whenever you take morphine or Percocet or anything that's an opioid, we have receptors in our brain called opioid receptors. So there are various ones. There's mu, there's delta, and some of them are more so for pain relief, and some of them are for euphoria. It makes you feel good, giggling. And so whenever you take an opioid, it binds to that receptor and it tells your brain, oh, feel happy or feel less pain. Well, over time, and I'm talking about within a couple of days, your brain starts to adapt to that. So it says, oh, well, all of my receptors are taken, so I'm going to draw more receptors up there. So you're going to need more and more of that opioid. So for me, and listening to a lot of patients, especially when I was in medical school, say that I got onto heroin because I got in a bad car accident, or I had a surgery and I was prescribed like this OxyContin, which is a very potent opioid pain reliever that is legal. And, it felt good, so I just kept taking it. So I was very conscious in starting patients off at a lower dose of an opioid to where their brain doesn't get used to it. Because once you get used to it, you don't feel that pain relief anymore. And actually your brain is like, oh my God, I need more now. Before you know it, you're dependent on it.
Yeah.
So using it recreationally, it's even more dangerous, because if you do get into a car accident, or you do have some pain, or I have to sedate you for a surgery, and this has happened to me before, where we're in the anesthesia department and we're trying to sedate this person, and whoa, normal dose of propofol, oh, he's still awake, okay, double the dose, oh, still awake, and then it's like, wow, are there any substances that you use that you're not telling us? Oh yeah, do heroin and I drink a lot. So you're having to give this patient 10 times even the normal amount of this drug, and as a physician, it is scary, because the brain is just like, wow, I have all of these receptors. In order for me to get the normal response, I'm going to have to give you triple the dose.
Yes.
So these are not inert, not benign substances, definitely not for recreational use, because in the event that you do need it, it's not going to work.
Correct. Which is why when patients are trying to come off of drugs, I keep saying patients because that's where my experience has been. When individuals are trying to come off drugs and they're trying to get a replacement to stay clean, and they end up in these clinics and these hospitals and they're asking for pain medicine, it takes an exorbitant amount of pain medicine to even give them relief, and we feel uncomfortable writing that. One, because we're in the middle of an opioid crisis for the same reason, and because the DEA is also breathing down our back, because we have these people doing things that they would not normally do to get the drug. So when Dr. Hart speaks and he says that our basic rights is life, liberty, and the pursuit of happiness. Okay, those are 3 great basic rights, but when you start infringing on other people's rights to get what you need, it becomes a problem. So I have not seen many people who use drugs. So Dr. Hart did say there are functional users. There are, but there are very few. For most of the people that use drugs, that are out of control, that run out of money, they break into people's cars, they carjack people, they do whatever they have to do to get the drug. And at that point, it doesn't become a pursuit of happiness. It actually takes this patient to get so far down, these individuals to get so far down, to realize that they're miserable to even get them clean. So when we speak on Dr. Hart, speaking of Switzerland and these centers that way people could go in and get something in the morning and something in the evening, that alone too is still very life altering. What if your job is a 12-hour job and the center closed before you're off? We do have those same programs here. We have methadone clinics, we have Suboxone clinics that give low dose opioids in a controlled setting. Suboxone is with the Narcan component attached so that they're unable to use or get a euphoric benefit from the use of the drug. And people don't, when they become addicted to these drugs, very few people are in the mind frame to say, I want those centered treatments. So I think it's quite unrealistic for Dr. Hart to make it seem like there are safe ways to do this. If you get on drugs, you will not get addicted as long as you go to these centers and you make sure your drug is safe, or you make sure that you have these low dose opioids. It's not realistic. We're in the USA. They don't exist. Right. So in my mind, the book is putting out a false hope of a safe drug use to people who don't have those benefits or can travel to the 50 countries or wherever he's been at to speak on these things that other countries are doing. I do believe that we should not have people sitting in jail for 18 years for a heroin charge, because remember, this speaks to some of the same stuff we're going through now with Black Lives Matter. It's social injustices. It's injustices because of poverty and things like that. So yeah, that's why you see the most of the drugs at, but they do exist. I want to speak on what Angela Yee spoke on. She was speaking of in her high school where there were people just like her, where she didn't say that she did drugs, but they were doing drugs and they are professionals now, or they are successful per se. Well, that is not a reality for most people. If you go into these poverty-stricken places, they're dealing with tainted drugs. They're not dealing with that. So to put the message out that people do use drugs and people have been able to be successful without them, I feel like it's creating a sense for the people that may not know better, our population of people who are the most to be affected by this. So I just wanted to use our medical knowledge, both me and Dr. Washington, and speak on this and tell you how this hits home. I know personally, my mother was addicted to crack cocaine. I thank God today that she is alive, but my mother didn't smoke, she didn't drink, she didn't use drugs. And she was affected by this drug because somebody else introduced it to her and she was naive and she got addicted. So somebody who was very responsible, raised very responsible kids. As you can see, I'm a professional. I did very well, but it took a lot of work for me to do well because the drugs destroyed my family. It destroyed my life. As a senior in high school, I was homeless. There were so many obstacles I had to go through to beat what the drugs do to families, and everybody does not have the drive to do that. So I thank God for that, but I want to make sure the message that we're putting out for our community, for people that look like us, there are more physicians now, there are more providers that look just like us, that we can speak positive things on and get them the other help they need. Get them the mental help they need. Let them deal with their stressors. Create outlets for them to speak with mental people, with psychiatrists or psychologists to just unload and unpack some of the stuff they deal with. But we should at no times, but it should be encouraging a safe drug practice. Yes, you can take that drug as long as you know what's in it. You don't know what's in it until it's affected you. So please don't try that at home.
Please don't. And I also want to speak to the teenagers out there that are thinking about experimenting or feeling the peer pressure to even try it. You have no idea what are in these things. And I have seen it time and time again to where as young as, I'd say 10 years old, comes into my ER having overdosed on something and I don't know what it is. It's very, very scary, and it does change the way that your brain is wired. It does. It has an effect. And also, the last point I wanted to speak on is when Dr. Hart mentioned prescribed medications for like depression that you can withdraw off of that. So it's not like drug withdrawal. And as a DO, my belief is that if somebody comes to me with depression, I want to try psychology first. I want to try journaling first. My first thing is not to jump to put somebody on an antidepressant. And if I'm going to put somebody on an antidepressant, I'm reevaluating that patient within 6 weeks. Reevaluating that patient in 3 months, 6 months to see if I can start to titrate off, because I truly believe in your body's ability to heal itself. In this era, we're so used to, oh doc, let me get a prescription or an antibiotic for this. Let me get a pill for this. Your body is very, very smart. I am all for medications when need be, but we need to be more dependent and learn how to have coping skills to deal with life, because there's not going to be a pill for everything. And there are things in this life that are enjoyable without the addition of drugs. But at no point, nowhere is it safe to use any recreational drug just to use it, especially your opioids. And we will have a part 2 of this. I have never personally done heroin. I do see patients that have, but they all describe to me that they are chasing the first high, in contradiction to what Dr. Hart said. Has destroyed many a family, and definitely I respect him and his work in order to get his degrees, but he has never probably had to look across the room and tell a patient's mother or of a 17-year-old or 20-year-old mother that their child is dead, or that this husband is dead from a probable substance overdose. Until you see it clinically or you have personal experience with it, it's not a joke. There are functioning addicts out here, yes, but it creates a problem, and they do have health complications later that were not discussed at all. For the people out there that are dealing with opioid abuse or on substances, there are medication medications that can help you get off of these drugs and not have the side effects or withdrawals, so thank you guys for your time. We enjoyed this conversation. Sorry that there's road work going on, but we will be doing a part 2 because this is a topic that's near and dear to my heart because I have seen too many young people lose their lives way before their time.
It's definitely something that's near and dear to me. As I said, it was something that I was affected with as a teenager with a mother who had no problems in terms of substance abuse. She didn't smoke cigarettes. She didn't use alcohol. So I just want to make sure that the message is clear and we're protecting our community and saying that there are other ways to deal with this. There is no such thing as a safe way to do drugs. These drugs are unpredictable, they affect people, and they destroy lives, and they do not discriminate. I also want to make it clear that he mentioned that this is something like it wasn't around in the 80s. Sure, it was around in the 80s, it was around in the 90s, but it takes a while before it becomes a crisis, a pandemic and a crisis. So what you're seeing now is the effects of 20 years of opioids, and it wasn't that big of a deal for America as a whole, I'm gonna say that, because it was mostly in our poverty-stricken areas, but now as you can see, it doesn't discriminate, it's everywhere. So now it's become a highlight, it's an opioid crisis, and it's of utmost importance that the government fixes it. So some of these ways to fix it is to bring highlight and true awareness to what is going on. I see these patients every day. I treat multiple patients like this with antibiotics every day that I speak with and get relationships on and meet their families, their children, and other people affected by this. And I will be doing my own personal research on this so that I can report back later what they're feeling if they had responsible actions in their life prior to this, the things that drove them to do this, and how hard it was for them to actually seek places. So thank you for your time. We are here for you as medical professionals, both physicians and practitioners. And the message today is don't do drugs, don't try it. There is no safe way. Thank you, Dr. Hart, for at least putting some material out there and doing some research. But what we want to tell our community is absolutely not. This affects everybody. Don't even try it.
So I wanted to take a moment to discuss this picture that I found incredibly interesting and very disturbing. This is a picture of equivalent doses of heroin to fentanyl to carfentanil, which some street drugs, when you buy heroin, it's being laced with fentanyl or carfentanil, and there's no real way to tell that until you ingest it. Carfentanil is actually an animal tranquilizer, and it's much more potent than heroin. So just even a tiny piece of it in heroin causes a significant amount of respiratory depression, leading to death. Even after rounds of Narcan, the effects of carfentanil being laced in heroin cannot be reversed. So I just wanted to draw attention to this picture to really give you guys a huge sense of urgency and really think about drug use, especially recreational drug use. You don't know what's in these things, and its effects may be fatal.
I do write a book just instructing other nurses that carry on and transition over to be providers and how to do that safely, and some of the pitfalls that you want to avoid when you haven't gone to medical school and you were a nurse like myself that actually went on for more education to learn to assess and diagnose and treat patients and become a provider. So I want to make sure that you nurses out here that are transitioning on to providers know how to safely do that, the things that are not taught in our programs, and the pitfalls that we should watch out for. So thank you so much for your time. The message was so much greater, but thank you for highlighting that about my book.
Yes, and we'll be talking about more current events, and if you guys want to talk about any topics or bring up any topics, please comment below, like, share, and follow us. Thank you for your time. Bye-bye. See you later.